You have been recommended to watch this video because we would like you to understand how the pain medicines you take affect your body and that this may be causing you some health problems. In this video, we are focusing on opioid medicines, which include morphine, oxycodone, codeine, tramadol, fentanyl and buprenorphine. These can be taken as tablets, liquids or patches. Opioid medications are very effective medications for short-term pain, like after an operation or an injury. However, over time they become much less effective. If you have had pain for a long time, you'll probably have noticed that your dose has increased over time and often that your pain has worsened despite this. Whilst your body gets used to the pain-killing effects of the medication, unfortunately the side effects build up with higher doses. There are some very common side effects that you will probably be aware of, such as reduced enjoyment of food and constipation. However, there are also a lot of other side effects which might be less obvious and more surprising. Opioids affect just about every system in the body. The picture on the screen now shows many of these. Opioids can have significant effects on your mood, worsening mental health problems and often making you feel out of control, lacking in motivation and enthusiasm, or tired a lot of the time. They can also have an effect on the breathing system, which is of particular concern if you suffer from a condition known as sleep apnea. If you require an operation or have an injury which would normally be treated with opioid medication, it will be much harder to control your pain. And at higher doses, amazingly, opioids can even worsen your pain. You can pause this video here to take a closer look and decide which of these side effects might affect you. So it's possible that your body has become so used to the medication that it is no longer effective for your pain, whilst at the same time it is causing unwanted changes to your body and health.
In general, the higher the dose of your opioid medication, the more we would encourage you to consider reducing it. Have a look at this thermometer on the screen, which indicates how different doses and medications compare. You can always pause this video to look at the thermometer for longer and work out where your medication fits. If the amount of medication you use in a 24-hour period puts you in the amber or red zone, you have a lot of potential to benefit from a gentle reduction plan. If you regularly take more than one medication on the thermometer, the effects are additive, or in other words, you are likely to be in the amber or red zone. If you aren't sure, please contact your healthcare provider who would be able to help you to understand this better. Many people feel unwell or have increased pain when they delay or miss a dose of their opioid medication. Understandably, this leads them to assume that their medication is helping their pain. In reality, if you have been taking opioids for a while, these are usually signs of withdrawal and are usually not a sign that the medication is effective. It will probably surprise you to know that many patients are able to very gently reduce the medication over time with no long-term increase in pain. Most importantly, many people feel significantly better as a result. We understand that the thought of reducing medication is difficult. Many people worry about the pain being worse. However, reducing the medication means that your body is less tolerant to it. You may prefer not to take any opioid regularly in the longer term, but if you still find it helpful, lower doses are often able to keep on top of the pain better. It can be very helpful to consider what you could do instead of taking medication to stay in control of your pain and make sure that you are in the best possible health. We can help you do this.
The simple rule for everyone is to reduce slowly and gently to allow your body to adjust to the new dose gradually. If you've done this before, you may feel confident to do this yourself, but we understand that this may feel daunting for many people. It is normal to ask for help to reduce medications. If this is you, please speak to your GP practice pharmacist, who will be able to talk you through the process and make sure you have the right doses and support. If your pharmacist needs help, This is available from the hospital pain team, and you can also be referred to the pain service at the hospital if your reduction plan is more complicated or difficult. It is always advisable to consider non-medical ways to manage pain, even if you continue to take medications. These can replace or help reduce medication successfully for many people. Gentle movement, rest, distraction, supports from friends and family, and social activities can all help you to manage pain. You can find more information on how this could help you at the Live Well with Pain website, linked in the text underneath this video.
Your healthcare professional has a duty to encourage you to reduce your medications if they feel that the dose is worrying or are concerned for your safety. It is particularly concerning if you are taking more than one different sedating medication at the same time, as the effects all add up and the risks to your well-being are higher. Keep in mind also that higher doses and combinations of drugs can quickly become more of a problem if you become unwell for other reasons. Under these circumstances, doses might need to be reduced quickly. If your healthcare professional is very concerned about the safety of your medications at any point, they may have to insist on a reduction to prevent major problems. Generally speaking, however, reduction plans can be adjusted and tailored to suit you as an individual, allowing you plenty of time to adjust to each new dose. Unless there is a particular safety concern, the reductions can be very small and infrequent. If at any point the reduction becomes more difficult, rest assured that pausing and keeping the dose stable for a period of time allows the body to adjust effectively. Our aim is always to make sure that you have the best possible pain relief with the fewest possible side effects. We are here to help you to make the most from your medications.